The Millennium Development Goals places emphasis on a number of interlinked and interrelated goals, and the Nigerian government, through the Office of the Senior Special Assistant to the President on MDGs, has targeted funds from debt relief gains at core MDG-related government ministries, departments, and agencies. Majority of funding for these establishments have been directed to providing health, education, water, and empowering the poor. The health sector has enjoyed special attention because three goals are tied to it: reducing child mortality, improving maternal health, and combating HIV, AIDS, malaria, and other diseases. Have seen the Health Ministry and the MDG's office working closely over the past 4 years.
The people have more access to health facilities. They have more access to treatment. Treatment is provided free under the free healthcare programs in the state. We have a conditional cash transfer scheme that provides cash to the most vulnerable in society, the poorest of the poor in the society. And these programs are designed not just to provide them with cash, but also to provide them with skills.
The MDG office in Nigeria is also doing quite a lot to ensure that the partnership goes to intergovernmental levels with the subnational governments, especially at state government levels. Now it's going to get even further down to local government levels.
The development partners, the federal government, the state government, and the local governments are now partnering in ensuring that we arrive and achieve our objective.
Funds are being put to use in all teaching hospitals nationwide. The University of Uyo Teaching Hospital got the sum of 70 million naira from the MDG's office and built a modern healthcare facility that rates among the best in Nigeria. This facility has catered for the poor and vulnerable groups in the community because community health workers reach out to the rural dwellers so they can access the services available here. And this has pushed up the rate of women coming here for deliveries. There has been over 40,000 deliveries here since 2006.
There have been a number of supports to immunization, to TB, to HIV in terms of prevention and procurements of drugs. We also have invested in the infrastructure, increasing the number of primary healthcare centers over the years. But as we have done this year on year, we've continuously reviewed with health where really are the gaps. Service delivery at the end of the day is the most important. No amount of hospitals that we build or reinforcing procurement that we do, unless we've got the human resources to deliver that service, becomes a big issue. So of recent, we've been able to collaborate on providing the resources for the 2,500 midwives that have been put into the system. We've also looked at women's affairs who have complemented that with the provision of ambulances, with advocacy on maternal and child health.
Apart from health, the MDG's office is also targeting quality learning outcomes by improving teacher skills, increasing school enrollment, providing teaching learning materials, and providing enhanced learning environment. Across Nigeria, there are many ongoing projects aimed at making sure every child gets basic education.
By 2015, if we continue to invest the way we would do, our children will enter and finish a complete cycle of education, primary education, remembering that that is the target for the MDG goal on education. However, our greatest concern in this country has been the quality of the education that we're delivering. Our children getting an education, it's one thing to say they're putting them through a system, but when they come out at the other end, what are we equipping them with? And I think that that's where we have the biggest challenge. And so you'll see the investments that we make here, together with the UBE, the Federal Ministry of Education, have always focused on quality. Using the teacher production, looking at the colleges of education. We have rehabilitated all federal colleges of education, I think bar 2 that came on newly of recent. We have looked at 145,000 teachers annually for in-service training on English and math and science, where we really are very weak in the basic subjects. We've also provided, in trying to fill the teacher gap, 40,000 teachers every 2 years, and that's been a challenge. But you can see that the agencies are responding to make it work. And every year you can see that there is an improvement in terms of the delivery and the enthusiasm of our teachers in taking up the role of trying to improve what they deliver in the classroom. So this year we're looking to see how we can improve that. how we can bring the states on because ultimately they have to pay the recurrent bills for this. And I think when we talk about the MDGs, we must look at the sustainability, that beyond 2015, that we're looking to go up the next step, not now backtrack to say, okay, it has slipped again. We must never slip below the targets that we've set ourselves for 2015. It's the basic foundation.
The lives are getting better. Where we were in 1999, 2003, 2007, 2009, there's no doubt about it that the life of the average Nigerian, whether you're looking at access to education, you're looking at poverty level, you're looking at health, you're looking at education, it's improving all the time.
The MDG's office collaborates with core government establishments to fast-track implementation. This has also helped to gradually develop Nigeria's capacity at the national level towards achieving sector and nationwide development.